recognizing the role of maternal mental health in child development, Baby-Friendly Spaces is a holistic, evidence-based psychosocial support program implemented as a part of child malnutrition prevention. Services aim to enhance mothers' well-being, internal resources, and child care skills to mitigate the negative impact of humanitarian crisis on children. Baby-Friendly Spaces assisted displaced Rohingya mothers and their young children in refugee camps in Cox's Bazar, Bangladesh. Over an 8-week period, mothers worked with trained psychosocial workers via individual counseling and group psychosocial stimulation, for example, baby massage, play, and nutrition, to develop mother-child bonding, best childcare practices, and maternal mental health. The researchers used a mixed methods approach evaluating the effectiveness of sessions on functioning, well-being, and positive coping. They also examined downstream impacts on fathers and families as well as impacts on organizational stakeholders and the host community.
Alianza con organizaciones por lo emocional.
Or a couple, examined the effectiveness of the community-based psychosocial support services. In a pilot study, participants in community support groups conducted showed significant improvement in well-being and reduction in distress from pre- to post-intervention, although coping results varied. A couple served survivors of armed conflict in Quibdó, Colombia. The intervention consisted of 8 weekly group sessions facilitated by non-professional community members with training supervision from professional MHPSS providers. Sessions focused on collective problem-solving skills combined with expressive activities based on cultural practices. Researchers measured the effectiveness of the finalized adapted ACOPL model using a randomized controlled trial methodology. Migrants face mental health and psychosocial problems, protection risks, and disrupted social and community support systems. Entre Nosotras was designed to address salient psychosocial needs of migrant women, namely psychological distress, lack of social support and isolation, xenophobia and discrimination, and safety concerns. Entre Nosotras served forced female migrants in Guayaquil, Tulcan, and Panama City. Entre Nosotras is a 5-session intervention that combines elements of psychoeducation, problem-solving, stress management coping, safety planning, and mobilizing social support and resources. It was implemented by pairs of trained community members to groups of 6 to 10 women. The study evaluated the feasibility of delivering the standard and enhanced version of the intervention using a cluster randomized comparative effectiveness feasibility trial. 225 women were evaluated for their psychosocial well-being, psychological distress, social support, coping strategies, and functioning. Psychological distress is quite high among refugees in Uganda, affecting both caregivers and their children. However, there are limited health services and less than 1% of the total population of people with mental health concerns in Kiriandongo are able to receive MHPSS services. The Journey of Life intervention served refugees, specifically children, adolescents, and their caregivers, in the Kiriandongo settlement in Uganda. Journey of Life engages caregivers to improve their own mental health, caregiving knowledge, and skills to support children. It was implemented by non-specialized humanitarian workers over a series of 12 sessions. This intervention employed a hybrid effectiveness implementation, quasi-experimental waitlist control design. It primarily measured mental distress and, secondarily, social support, functioning, warmth affection subscale, undifferentiated rejection, and attitudes toward violence against children. A nurturing family environment is essential for child and adolescent psychosocial well-being and can buffer the effects of stressful events. Yet, there is a gap in documented programs addressing the whole family, particularly in humanitarian settings. Nurturing Families was provided to Syrian, Iraqi, and Jordanian refugees in East Amman, Jordan. Nurturing Families is a comprehensive, family-based intervention that helps vulnerable families function better, feel stronger, and ultimately offer a nurturing environment for children. The intervention was piloted with 12 families experiencing multiple and complex stressors. It was implemented by non-specialists who received training and supervision from a local supervisor with an MHPSS background. Researchers used a qualitative and quantitative approach plus a feasibility randomized control trial conducted with 60 families. The following were measured: parent distress, child distress, positive parenting, family relationships, parent ability to manage emotions, the impact of problems on the family, and child well-being. Most evaluated MHPSS interventions in humanitarian settings focus on individual mental health treatments, while evidence for community-level interventions addressing basic services, security, and social support remains limited. To address this gap, we evaluated the 5 MHPSS interventions in our collaborative to measure their effectiveness and identify facilitators and barriers to collective impact in community-centered prevention and early interventions. Our analysis had 2 key components. First, we assessed effectiveness using 4 harmonized outcomes: distress, functioning, well-being, and coping, identified through learning collaborative harmonization workshops. Second, we documented program adaptations, utilizing the FRAME IS tool, including intervention content, provider training, and community engagement strategies, to better understand implementation processes. Our cross-study effectiveness evaluation showed the strongest effects for distress outcomes, while findings were less consistent for well-being, functioning, and coping. Overall, it proved challenging balancing emic and etic perspectives in the selection of standardized and localized measures that could facilitate meaningful cross-study comparisons while still identifying unique population-specific outcomes. This cross-study analysis revealed the importance of using a mixed methods approach to evaluation, incorporating context-specific psychosocial outcomes, and developing better instruments to measure these outcomes more effectively. Documenting and comparing program adaptations across the 5 studies highlighted the piloting phase as crucial for tailoring interventions to local cultural and socio-political contexts, particularly by eliciting community support in program design. The majority of intervention adaptations reported across sites focused on implementation strategies, with many driven by unanticipated challenges, such as COVID-19. The cross-study comparison of these adaptations underscored the value of systematically recording them. This information is essential for scaling interventions, identifying potential barriers, and optimizing resource allocation. Additionally, we found the use of FRAME-IS encourages transparency and accountability throughout implementation,